What's going on, guys? Tony Muratato here, licensed physical therapist, and we still get lots of questions about finding the best position to sleep in after a total knee replacement surgery. Now, that's a loaded question. That's a hard one to answer because it takes a lot of background information to know what is the best position for you to sleep in compared to 20 other patients who have had a knee replacement. The generic advice that circulates through the internet is you have to sleep flat on your back. You have to have your leg propped and fully extended to prevent flexion contractures, meaning we want the knee to be straight. Straight knee is what is going to help you the most when you're walking. So we need you to spend 8 hours a night sleeping with your leg perfectly straight. The reality is most patients are not sleeping 8 hours a night. Not every patient has a problem with terminal knee extension. Not every patient can sleep on their back. What about patients with issues with spinal stenosis or sleep apnea or other congestive issues that need to have some sort of elevation or sleep on their side? So to just take a one-size-fits-all approach to sleep is irresponsible at best. And so I want to talk about some alternatives. The first thing to consider is, how is your swelling? How is your swelling? If you're significantly swelling, if the ankle, the lower leg, and the knee are dramatically accumulating fluid throughout the day because the leg is in a down-dependent position, then yes, we need to get you on your back. We need to get the leg elevated. We need to get that fluid back into the system. But there are options. You can consider compression wraps. You can talk to a lymphedema specialist, which is a therapist that's been specifically trained in helping patients work with excessive edema after surgery. Another thing is, like I said, how is your extension coming? If you have full extension or close to full extension, you might not need to sleep flat on your back with your legs straight and elevated if that's not a comfortable position for you. The other component is, we always talk about flat on your back, leg elevated and extended, but what about on your stomach? There are lots of belly sleepers out there who love sleeping on their stomach. Sleeping on your stomach in that position is what we call prone position, and that puts your knee into full extension, and some people would prefer that over sleeping on their back. So just understand that there are lots of options for you out there. First thing you do is you talk to your surgeon, you ask better questions, you have a discussion that allows you to get the answers that you need. And if you can't, because maybe your surgeon doesn't have the time or is too busy, you talk to your physical therapist, maybe you reach out to an occupational therapist. There are lots of professionals who can give you the right advice for your specific situation. Don't necessarily take a one-size-fits-all approach to your knee rehab, because this is your knee that's going to be with you for the next 20, 30, 40 years. We want to make the best possible experience available to you. If you have more questions about this, please post them in the comments below, and I'll catch you next time.